A very good afternoon, everyone. I'm Sayukta, your host for today's live from All About Skin Wellbeing team, and I'm sure all of you must be doing really good. Today, we are going to discuss about our skin health with focus on dry skin condition. Now, dry skin condition is a condition in which skin cells build up and it can cause the skin to feel rough, tight, flaky, or scaly. The location where these dry patches form vary from person to person. It's a common condition that affects people of all ages. As you know, in today's digital world, it's always a boon or blessing if we can get to hear from an expert dermatologist online about dry skin condition, how we can prevent it, and the kind of test required for its diagnosis, and the right treatment and management approach for an early relief. So, ladies and gentlemen, today we have with us renowned dermatologist Dr. Charan J.C., a plastic surgeon, and he has an experience of more than 16 years in this field. Dr. Charan J.C. practices at Aesthetic Multi-Speciality Clinic in Zafar Khanpet, Chennai. He completed his MBBS from Sri Ramachandra University, Porur in 2009, MS in General Surgery from Annamalai University in 2013, and MCH Plastic Surgery from the Tamil Nadu Dr. MGR Medical University in 2017. He is also a member of Association of Plastic Surgeons of India, APSI, a lifetime member of Tamil Nadu and Pondicherry Association of Plastic Surgeons, also for life member of Breast Reconstruction and Aesthetic Surgery Association and Ghent Association of Plastic Surgeons, GAPS, for lifetime member, and some of the services provided by the doctor are neck lift, liposuction, lipodissolve injections, wrinkle treatment, fractional laser, etc., etc. It's such a pleasure to have you with us, Dr. Charan. A very warm welcome to you.
Thank you for having me. Yes,
So today, doctor, we are going to talk about dry skin condition. Now, as a layman, we all know, especially during this, transition of weather. So winters are over, spring is here, and also summers in most part of the
right.
country. The air, the weather is quite kind of harsh on our skin. It's that dry air which is causing a lot of dryness on our skin. So first of all, we would like to, understand why dry skin condition takes place. What are the common causes of it?
Okay. So basically, I don't know if many people know this, but skin has five layers. You have the epidermis and you have the dermis. The epidermis has five layers there. So usually, the layer which is responsible for dryness or the barrier protection is called stratum corneum. Think of it like as the brick wall of the house or the roof. So in case there is some leakage in between the bricks which is happening, so what happens? Water starts leaking from inside or from the outside. So this is
Right.
what happens because of various conditions. The stratum corneum, that layer which is responsible for the barrier or protective mechanism of the skin, there is some leakage or some dryness, or the barrier becomes destroyed because of our own unhealthy practices. Then what happens is what the hydration or the water which is present from inside the skin is slowly transported outside, so that skin becomes drier and drier.
Right. So,
Yes,
doctor, we all know and understand that moisturizing our skin is important.
yes,
Before we talk about moisturizing the outer layer, our skin, first of all, we would like to talk about moisturizing our body from within, hydrating our body. How
yes.
important it is to, increase our liquid consumption or drink water a lot. People say that drinking water will actually help you moisturize your skin. Is it true? Is it correct?
See, we require around 3 to 3.5 liters and sometimes even 4 liters of water per day. But
Right.
consuming that over a single shot, or let's say within 1 hour, like you're going to
Hmm.
consume 1 liter of water in the morning, 1 liter of water in the afternoon, one in the evening, is not going to help you. You have to keep sipping water throughout the day to provide the adequate hydration that your skin, your bones, your joints, everything needs. So basically, yes, water, having adequate water will help you give that hydration from within, but it has to be spaced out. And too much water is also harmful. So limit your water intake by around 3 to 3.5 liters per day maximum if it's very hot. Otherwise 3 liters per day works well for most people.
Right. Excessive of anything and everything can be bad, the same as with water. So,
Yes.
adequate amount of liquid consumption throughout the day is important. Now, doctor, talking about moisturization of skin, how often we need to apply moisturizer, and especially, people who have oily skin, they feel that because my body is already, producing so much of sebum, why do I need to moisturize my skin? And this is one factor when most of the people who have oily skin do not use moisturizer. How important it is, even for a people with oily skin, to moisturize their skin.
Okay, first let's talk about from the beginning. So, what happens before moisturization? Let's
Yes,
start. We can start from cleansing. So now,
absolutely.
people, the basic reason why you get dryness or there is an epidermal, there's a trans epidermal water loss is because you over exfoliate, over wash your skin, or over cleanse your skin. So what happens is the barrier has some essential oils there. Those oils are completely stripped off because of the over exfoliation or over washing. So what happens? The barrier gets broken, whatever water is inside starts seeping out like this, and then your skin starts looking drier, itchiness, flakiness, all starts to happen. And
Right.
now we need to moisturize. So how do we moisturize? We moisturize at least what is adequate intake is around 2 to 3 times per day would be ideal per day.
Okay. So 2 to 3 times per day is adequate.
Yes,
As you were mentioning, doctor, that we at times over exfoliate or over wash our skin, which leads to dryness.
yes,
Again, because it's summer's approaching, and we have already in many parts of our country started using air conditioners. And the moment we spend some time inside a AC room, we find our skin so dry and dripped out of moisture. Would you like to shed some light over that?
yes, because the air conditioners actually affect the humidity inside the room. And what
Hmm.
happens is when the humidity gets sucked out, so does the water on top of your skin. So what happens is skin starts becoming drier and drier and drier. So people who are inside air conditioners definitely do need to moisturize. And coming back to your previous question, oily skin. Lot of people who think that they have oily skin naturally, I am producing oils. Why should I moisturize? So what happens is if your skin thinks that it is dehydrated, it is start going to produce more oils. So what happens when there are excess oils are producing, you will start looking more oilier. Second, the lot of oil gets clogged, the pores get clogged, and then you can start getting breakouts. So in order to avoid all of these, you have to provide adequate moisturization so that we can the skin thinks it's adequately hydrated and it does not produce excess oils.
Right. And to add to it, even people with oily skin feel that it is due to the excessive oil, and that's why they keep on, washing their face and hands again and again, feeling that
Yeah.
they'll get rid of the oil, excess oil.
Yes.
So it's also a very common practice.
Yes, yes, and a lot of people also are promoting this foaming face washers, salicylic acid based face washers, and they're saying like, okay, this worked for me, so you also try it out. So this, like the moment there is oiliness is gone, your skin starts looking a little brighter, a little more whiter. So what happens
Right.
is people, oh, this face wash is going to show me, it's going to brighten my face. So they start
Right.
using it 3 4 times a day. So what happens if you start over exfoliating or over washing is that ceramide or the lipid layer gets stripped off. Once gets stripped off, no amount of moisturizing or no amount of washing your face or no amount of applying any products unless that area is unless the barrier is repaired is like nothing can help you get that glowing skin that everybody wants nowadays.
Right. So maintaining that good skin barrier is equally important, and
Very, very,
moisturizer
very.
plays a very
Yeah.
important role, whatever is your kind of skin type you have. Now, doctor, can dry skin lead to other skin-related issues as well? Skin
Yes, of
problems.
course. Because once the barrier is gone, then the skin becomes more susceptible to other infections, bacterial infections, fungal infections, viral infections. You can get eczema, dermatitis. It just can keep, worsening and worsening and worsening. As long as the skin barrier is maintained, as long as like your skin is soft and supple, then chances of ulcerations and small injuries are very, very, very low.
Thus, moisturizing your skin is the first and most important preventive measure we can take to avoid all these skin
See,
related issues.
okay, so moisturizing is not the first step in your skincare, but moisturizing is a very, very important step in your skin, basically. So, how we moisturize, I'll explain how you can layer your product, what products you can use if you have a dry and sensitive skin, what products you should avoid. So that because if you start using these actives more and more, they're going to keep damaging your skin, and then no amount of moisturizing is going to fix. We're going to stop, keep continuing to use those actives.
Right. And we would like to come to those steps only, doctor, because nowadays market is flooded with products. We
Yes,
have so many influencers endorsing these products, and then we have this customized products as per your skin type online, and we fall for it. We tend to buy one cream, use it for 2 months maybe, and then fall for another cream, and we are experimenting a lot. We are buying like 50 bottles in the name of skincare regimen, and practically using 50 bottles in a day is not possible.
yes.
So, what to use, how to use, when to use, doctor, the basics.
Right. So basically, first of all, let's go with soaps. Okay. So most of us do not have the see. Even me, before I did my specialty, I had no idea about soaps or cleansers or anything, because
Hmm.
all of us were just taking one soap and then we just went by the mark. So what
Yeah.
happens is our skin has a pH of 5.5. Most of these soaps which are produced have a pH of 8. So naturally higher pH. So what happens here is the soap makes it very dry and strips off these oils. Though it's natural, it can be made of Ayurveda, it can be made of neem, tulsi, sandalwood, name it, whatever it is. As long as the pH is going to be higher, it's not matching your skin pH, it is going to damage your skin. Be it a baby soap, be it even baby soaps are doing the same thing. Okay.
Right.
And the moment the soaps have a fragrance, that is going to irritate your skin. So if you have a sensitive skin, if you're going to buy the most superbly smelling soap and use it, you have a chance of irritating and drying out your skin more. The first step I would recommend is to go for a neutral cleanser with a pH of 5.5 or a gentle skin cleanser. That will be the first step. Okay. Once you wash it, ideally, how many times you should wash it? As long as your skin is healthy, you can wash it once in the morning and once in the night before you apply your skincare routine. Otherwise, you can wash it once a day and then you can apply dry moisturizing, dry cleansing to your skin. Okay. So second, the most important product that we use is hyaluronic acid. As soon as you wash, there is a 3-minute rule. When the skin is moist, within 3 minutes, apply the hyaluronic acid. If you're going to wait until your skin is completely dry and apply the hyaluronic acid, it will pull out the water from inside the skin. The basic idea of how it works is hyaluronic acid traps whatever, it just pulls out whatever water is there. It can pull out up to 1,000 times its molecular weight. So if you're going to apply when the skin is damp, there is going to be some external, water molecules there, and hyaluronic acid is going to use it and make and hydrate your skin. If not, it is going to dry out your skin more. Okay. And you can use your niacinamide. You can use, please avoid AHAs, avoid retinols or frequent use of retinols. As long as your skin barrier is fine, using retinols above 35 at least 3 times a week is beneficial. Using retinols at 20 is not recommended, and you don't need retinols at all. And if you don't need salicylic acid, if you don't have a oily pimple prone skin, and salicylic acid is very, very drying, so don't use it on a regular basis. Then what happens is, you have to, once you apply these actives, vitamin C is very irritating for your skin. If you need to apply vitamin C, don't go beyond 5 to 10% and go for the minimally irritative options, not the plain pure vitamin C. More than 10% is not recommended. And finally, you have to apply a moisturizer. And a moisturizer has to be, if you want to repair your skin, go for a ceramide based moisturizer. And a moisturizer is the last step, essentially one step before your sunscreen. So the moisturizer, what it does is it seals all of the products inside and creates an occlusive layer. So naturally, you can use glycerin, which you can use. Aquexel is a good molecule. You can use ceramide as your moisturizer.
All right. So cleansing, then whatever
Hyaluronic
actives,
acid,
and
yes,
then the
cleansing,
moisturizer,
hyaluronic acid, then your actives, if at all
and
you
then
need your actives, and then is your moisturizer. And last
moisturizer.
step of the skincare is, if at all you have very very dry skin, then you can go ahead with a rosehip oil or a squalane oil, which helps you to repair the skin barrier, and even more to provide an occlusive layer over your face, so that all the moisture which is provided by the previous products is going to be completely trapped inside. Finally, apply a sunscreen. Without a sunscreen, nothing is effective.
Right, because you mentioned sunscreens, Dr. Charan, and again, sunscreen is something we all know it is important, but then we don't use it on a regular basis. We mostly use it when it's sunny, when we are going out, when we are going for beach vacations, etc., etc. How can, because we are talking about dry skin conditions, so in making it relevant with in association with sunscreen, how important it is to apply sunscreen on a regular basis, and reapplication is equally important in case of
Yes.
sunscreens, right?
So basically, sunscreens have this rule. So whatever is your SPF, then you apply multiply that by 60. So that is the number of minutes that the sunscreen is going to be active for or effective for. So let's say you have 30 SPF, you multiply it by 10 or 6, then you get 180 minutes or max 300 in some cases, which is roughly around 5 hours. So your sunscreen is going to be effective only for 5 hours. Similarly, for somebody who's using an SPF 50, you can just calculate and it just varies like that. Preferably for dry, sensitive skin, we prefer mineral sunscreens because they are basically a barrier method. They do not get absorbed inside the skin, they do not cause skin irritation, and they do not have other harmful effect like the some of the other chemical filters have, like oxybenzone. But here we look for a titanium oxide or an iron oxide based sunscreen, and also look for, if at all your skin is very oily, you want to look that now you have a lot of sunscreens which are mineral sunscreens and have tinted base. So, and sunscreen has to be applied, if it's a chemical filter, 20 minutes before you go out. If it's a mineral sunscreen, just before you go out, reapply it. And if you're going for swimming, based on the water resistance of the sunscreen, usually the maximum is around 80 minutes. So after you finish your swim, you have to reapply your sunscreen. This is very 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 important. And do not forget your sunscreens even when indoors, because you're being exposed to like blue light from your phones, from your TV, from your monitors. So you have to apply sunscreen even indoors.
Right. So even if you are indoor, because we have so much of screen time these days and it's
Yes.
equally damaging, so please use sunscreen no matter where you are. And reapplication amount of sunscreen that you're applying, everything plays an important role. Now, doctor, because we are trying to talk about dry skin conditions, does dry skin indicate any other imbalance in our body?
See, yes, dry skin can happen in a lot of other systemic conditions like diabetes. Diabetes is one of the most commonest causes of, dry skin. Hypothyroidism. Hypothyroidism also can cause dry skin. Kidney disorders. Chronic kidney disorders can also usually reflect as a dry skin. Liver disorders, liver diseases, especially like if there is a bile stasis, like cholestasis, then that also can cause. And if somebody is malnourished, so what happens is the lips usually they starts cracking up, and then you can start seeing small the scales in the skin. And also in all these autoimmune diseases, HIV, and after post radiation, when do you know the skin like the radiation amount is exceeding, is because when the skin starts getting drier and the skin starts getting pigmented, then you can think that the radiation amount is too high, so they manage the doses based on that. So these are some of these conditions. Like sometimes you can also have an autoimmune disease like Sjogren syndrome, where the skin is perennially dry because of some genetic abnormality.
Right. We often say that skin is kind of a mirror of what is
Mirror to
going
reality.
on inside. our body. So
Perfect.
mirror of our health. Yeah. So in case you have a dry skin, please go and consult with a good dermat, so that even if there is something which is not correct inside your body, they at least will get to know it and tell you to consult the right person. Go to the right person, which is a qualified dermatologist, in case you have anything to do with your skin. Now, when I say, doctor, go to a qualified dermat, people often don't, especially with our skin. We are so not serious. We'll go for home remedies, we'll go for over the counter products, we'll go for parlor saloons, but only when we feel that things are not working, that's when we go and land up in front of a doctor. Why
Yes.
home remedies, applying creams, applying a number of things on our skin, or buying so many products online, which we have already spoken about, why they don't work, and why we need to go to a dermat?
See, for example, okay, let me just highlight certain things. Somebody had spoken about turmeric. Applying turmeric is going to like increase your skin brightness. And
Mhm.
one of my patients has come to me and they said, I took turmeric and I like, just put it on my skin. She came with full of rashes and full redness over the skin. So, and one other patient came, they were using lemon juice for as a bleaching agent. And they did not know that already when you start using lemon juice is very, very abrasive on your skin. If you have very sensitive skin, it's just going to break out like crazy. So the people don't understand that one size does not fit everybody when it comes to skincare. Every person's skincare is different. My skin is different from like your skin, and whatever works for me will not work for you. So you have to go check the whatever is your skin type, whether it's sensitive, whether it's a combination skin, oily skin, dry skin. So based on these, we can prescribe particular products so that like it's not like we are not pushing products here. And if I say soaps are bad for you, it's not because I want to push a cleanser there. I'm having a scientific basis behind it, like pH is not balanced, so again there is going to be an imbalance and your skin is definitely going to dry out. So though a soap is going to be 50 rupees and your cleanser is going to be 300 rupees, you're going to end up way more spending way more when your skin is damaged in when you're trying to repair it. So the thing is, it is going to be most cost effective, more economical, and more mentally peaceful for you if you go ahead and consult a skin specialist, a dermatologist in the first place, instead of trying out so many different things.
Right. And in that process of experimenting with our skin, we end up damaging a lot. So by the
Yeah,
time we reach the dermat, we understand that if we could have come at the first place, the treatment duration would be,
much simpler.
way easier.
It's a much simpler, much faster, and a much easier treatment. And now we have to go back from minus 10 to 0 and towards whatever plus 10 we have to go. Instead of going from 0 to plus 10, we have to go from like we have to go now 20 steps.
Right,
That
right.
take time, and it's going to test your patience, and it's going to cost you more because you're going to have to get therapeutic products, heal your skin first, and then get back to getting that glow.
Right. Now, about what we were talking, I have this question from a viewer, Pinky. Can facial steaming help dry skin? Another way, easily marketable gimmick is to go to a parlor, get a hydrating, etc. All kinds of facials are there, steaming, etc. And they claim that you'll have a very, glowy skin. Do they really work, these facials?
Right. So basically, you can use a steamer, but you have to use it less than 5 minutes. Okay. And you can use it 5 minutes for 1 week. Okay. So what it does, it opens out your pores. So the hydration is going to be more. And you have to apply a hydrating mist or a hyaluronic acid serum and a moisturizer immediately after you steam. If you're going to leave it out, you're going to dry out your skin even more.
So these are the steps that you need to follow in case you are steam. Doctor, there's some audio related issues. Yeah.
Yeah, yeah,
Can you
yeah.
hear? Yeah.
Yeah, I can hear you. Yeah. So thing is, steam is okay. Once a week, 5 minutes a day, and then follow it up immediately with a uh, foaming mist or a hyaluronic acid serum or a moisturizer. It's must.
Okay. And how common is dry skin, doctor, associated with acne and atopic dermatitis?
See, dry skin can be associated with acne and atopic dermatitis. Usually, what happens is oily skin. Oily skin
Yes.
is. Am I audible?
Yes, yes, doctor.
Yeah, yeah. Usually, oily skin is there, and then what happens is they start using the salicylic acid serums, salicylic acid based face washes, overwash the face, and apply acne creams, and that can dry out your skin. So that also can lead to atopic dermatitis. So you have to be very careful. Don't start using all of these by your own. Please consult a skin specialist so that we'll know how much to use, when to use, because even your acne products can dry out your skin. The idea behind an acne product is because your pores are blocked and we want to like dry out so that you don't get acne breakouts. But overuse of that can destroy your skin barrier and can lead to dry skin and later on dermatitis.
Fair enough. Kiara is here, another viewer. Her question is, can dry skin cause flaky eyebrows?
See, usually dry skin can cause flaky eyebrows, but it is also sometimes like when your hydration is also that when you're physically dehydrated also and your skin is also dehydrated, that's when this flakiness can come.
Okay. Shikha is here, and her question is it okay to use anti aging products on dry skin?
Yes, yes, you can use anti-aging products, but please specify. Retinol every day is not recommended. Ceramides, yes, you can use it every day. And retinol 3 times a week. If your barrier is good enough, great. You can use niacinamide. You can use vitamin C, like vitamin C only if your barrier is good enough. Otherwise, if you have dry skin, just keep moisturizing and hydrating your skin. That itself will give you a good enough skin. If you have small blemishes, niacinamide can take care of it. Retinol, and you can also go for retinal, the other active which is there, which is retinal, not retinol, retinal. That is a little better than retinol, less irritating and also protective, anti-inflammatory. That works.
Okay. Meena is here. Her question, does aloe vera help with dry skin? I told you people are very obsessed with these home remedies.
See, aloe vera will help, but the thing is, you have to make sure that the aloe vera does not contain any fragrances, does not contain any additives which can, irritate your skin. So, aloe vera fresh form, yes, it can help you, give you that occlusive layer, give you that moisture inside your skin. But beware, sometimes aloe vera can also have germs, even if you are harvesting it, unless you are completely sure that it is germ free. Do not put it on your skin because I've had patients with breakouts even after applying aloe vera.
Okay. Rita is here. Should I avoid scrubs if I have dry skin?
Yes, yes, 100%. Do not use scrubs. These are bad for your skin. Never, ever, ever go behind anything which has a lot of foam, anything which has scrubs. It is very, very bad for your skin. Please go for a gentle cleanser so that it does not dry out the oils.
People use like three thrice in a week or once in a week exfoliation,
No, no, please do not do
cleanse.
all of that because your skin is already bad and you need sufficient time before the barrier is repaired. You start using AHA, 2% glycolic acid, 7% glycolic acid, 10% glycolic acid, your skin gets burned. And what happens? You will have a mark. That mark sometimes is permanent and you will have to go for a medical grade peels or other treatments which are way more expensive than your creams. So do not do all of these home remedies, do home brightening peels by yourself. What works for one influencer does will not work for 10,000 other people.
Right. And doctor, before we wind up the whole session, any take home message for our viewers?
Yes, first of all, do not over clean, do not over exfoliate, moisturize, adequate hydration is important. Avoid, if you want really glowing skin, there are three things you must avoid. Over caffeine, more than 3 cups a day is no no. Alcohol, definitely you should avoid because it dehydrates and it's a diuretic, so it will definitely dehydrate and dry out your skin. Third, sugar. Sugar causes inflammation. You can even see results if you are on a no sugar diet. You can see results as little as 7 days. So you can do that and start adding more skin protective things like chia seeds, like vitamin E, omega 3 fatty acids, and get a good consistent skincare routine which has a moisturizing and a sunscreen at the end. Nothing works without the sunscreen, remember, because you are constantly being exposed to UV rays and IR rays and blue light. So make sure that you are constantly using a sunscreen. Have vitamin C rich whatever you put on the skin, you can take it inside. You can clean up your diet, helps in your gut, and helps your gut clean your gut also. And if at all nothing works and your skin is perennially dry, suddenly you're all okay, suddenly you start having dry skin breakouts, then I think it's a indicator of something serious. So immediately go to a skin specialist or dermatologist and then see what's wrong inside you. It can be the harbinger of a bad news.
Right. So take your signs and symptoms quite seriously.
Very,
Don't
very, yes.
experiment with your skin. In case things are not, coming in control, please go and reach out to a doctor. Go to the right person. Don't waste your time for over the counter products, various brands, online endorsements, etc. Go to the correct person. In case it is related with your skin, go to a qualified dermat.
Yeah, and I
Anything you
also want to add
Yes.
exercise. 30 minutes of exercise is must. I didn't mention it before, but the moment you start exercising, your skin is going to start repairing itself. There's going to be a lot of collagen production, and you can, instead of taking collagen as such as a powder, you can take it as collagen broths. Like you can take it as bone soups. All of them are highly rich in collagen. Amla juice is very, very rich in vitamin C and antioxidants. And so every 30 minutes at least a day, 30 minutes a day at least, walk, climb stairs, do yoga, anything which works for you. It definitely go a long way in helping your skin heal and glow.
Okay, so take good care of yourself. Go for a good lifestyle, healthy lifestyle, work out, eat healthy, sleep well, and try to stay stress free. Indulge in whatever hobby you have and
Yeah.
stay happy. Thank you so very much, Dr. Charan. It was wonderful talking to you. Thank you for your valuable time and making this session so informative. Thank you once
Thank,
again.
thank you.
And viewers, thank you for your excellent participation in today's session. And for more updates on how to keep your skin healthy, do like and follow our FB page all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you and have a great day ahead. Goodbye.